Hey guys, just want to let you all know that we have a new Instagram account. Unfortunately, we got locked out of our old account, so now everything that we'll be posting will be on at new underscore capsule RX podcast. Okay, so check out there on Thursdays for your Test Your Knowledge Thursdays, where we'll be posting our NAPLEX questions to help prepare you for the NAPLEX, and also for any content related to our podcast. If you want to know about some new episodes or any of our infographics that we're posting, you can definitely check it out now at new underscore Capsule RX podcast. And I also want to announce that we have some new services. So this is something that we just started implementing. So I just wanted to inform you guys about this, that if you go to tinyurl.com/Capsule RX services, you can see that we are now offering CV and letter of intent reviews, residency and job mock interviews, as well as fellowships, presentation evaluations, journal club ideas and walkthroughs, and any NAPLEX tutoring. So these are some of the new services that we're offering. And like I said, just check it out at tinyurl.com/Capsule RX services to go ahead and sign up and get started working with us today. All right. I hope you guys enjoy this episode. Hello, and welcome to another episode of Capsule RX Podcast. Today, I'll be your host, Dr. Jovin, and today we have a special guest, Dr. Mary No. How are you today?
I'm doing well. Thank you so much for inviting me onto the podcast.
Yes, we're super excited to have you. Today's episode is going to be a little bit about Mary's journey to where she's at right now, which is a PGY1 resident at the San Diego VA. So she has a little bit of an interesting background of not going to residency right after school. So we definitely want her to kind of share her reasoning for why she decided to work a little bit and then go pursue a residency, and why she specifically chose the San Diego VA. So if anybody's interested in any VAs, we definitely recommend you tune in. Or if you've been a couple years out of pharmacy school and you've been thinking about maybe a career change, maybe this could be a great episode for you too. So to start off, Mary, can we kind of have you just give a brief introduction about who you are and how you got to where you're at?
Yeah, sure. I can share a little bit about myself here. So, hi everyone. My name is Mary. I am a 2019 graduate from Chapman University down in Southern California, and I was a part of their 2+3 accelerated fast track program, where it consisted of 2 years in undergrad at their undergrad campus and then 3 years at their pharmacy school. So I was pretty involved during pharmacy school. I know during my final year, I had applied. I didn't match, but there was also a lot of stuff that was involved on my end personally that involved like finances, supporting a family, that had led me into going straight into the workforce right after school. And I honestly thought that with the years in between, I was able to get more of a financial footing, as well as more of a better basis as to being able to like practice and be able to take a little bit of like an initial ownership, like in a pharmacist like world. And so when I was out of school, I got licensed, and a month afterwards, I was able to get a position at a psychiatric hospital, mainly working in their outpatient pharmacy. I got to work more kind of like in the community setting, which I would be involved in just being able to really provide medications to patients that are out in the community in Orange County from where I'm from. I also got to do a bit of discharge counseling as well, a lot of discharges just because we were the outpatient pharmacy for the hospital. And just as the saying goes, a lot of the population that I had to take care of back then were all those who had mental health, as well as other comorbidities that they had also come in with, and also those who are residing in sober living homes, drug addiction rehabilitations and whatnot. And so that's where I kind of had built like a bit of a clinical interest in mental health at the time. And so I feel like I kind of went through like a lot of mountains and valleys to get to where I'm at today. What kind of set off that idea or desire to really like pursue it was kind of thinking about, okay, like I'm here at this pharmacy. I'm not sure whether or not this is a long-term thing or not. And so I kind of had to reassess my interests in my long-term. I got to precept IPPE students at where I was before. And that also got me a lot more involved and interested in teaching in academia. I already kind of mentioned mental health in regards to my interest in patient population I took care of back then. And then also I really loved being able to connect with patients from like a direct patient care standpoint where it was like ambulatory care. And that was something that I wanted to do a lot more of. And so with all of these interests in mind, I knew I wanted to go into the outpatient route, hopefully ambulatory care, in the setting of mental health and also being involved in academia and teaching. And so a lot of this had come into play when it came to applying for residency and really trying to work in these interests and making it loud and clear when it came to pursuing the match.
And so when you were working at the outpatient pharmacy, just to clarify, were you doing a lot of counseling? Like, or was it just more counseling on giving the medication, on counseling on the disease state?
It was kind of a mix. Yeah. So it's honestly a mix of all of what you mentioned.
Okay.
So
it was kind of like an ambulatory care setting, but in a mental health capacity rather than talking about diabetes type of thing.
Yeah.
Like more chronic disease states.
Yeah. It's more chronic disease states. And I did have a good handful that had a lot of primary care areas, including diabetes, including those that have like hypertension, also those with dyslipidemia. One of the big things about like a good handful of psychiatric medications involve having a lot of metabolic like dysfunctions, and also with all that, it's something that I have to like consider. It's like as to whether or not they're going to have to be able to take their meds or not. If they are able to make like lifestyle changes on top of also keeping up with their medication. And that's something that, I felt, I could see myself in the future, being able to kind of address that, because, one of the things that I stand by pretty strongly by is really how mental health is just as tied and correlated strongly to physical health. And depending on how you are, it'll affect like how you are in the long run in terms of like your physical health overall and overall well-being.
Yeah, definitely. So definitely can attribute to like worsening metabolic syndrome, increased weight gain, increased lipid levels, like or triglycerides for some of the people that aren't in pharmacy that doesn't know what these terms mean. But yeah, so definitely I could see that playing a role. And so you're kind of counseling whole on the patient, and you realize like, hey, I've been doing these things and I don't know if this situation will last. I don't know if this will be long term. So I want to pivot into something where I would be probably more well recognized at other job opportunities for being somebody who is serious about this. So it sounds like to me, you realized, hey, I need to make my CV say that I want to be this type of pharmacist. So you decided, and that kind of pushed you to apply for, I'm assuming it would be mainly VAs or any place that has some type of mental health rotations, right?
Yeah, definitely the latter. I know in general, a lot of VAs have a focus in mental health. They have like for some VA locations, I know that they have like kind of like a mixture of like primary care and mental health involved too, where it's more of what they do is like a whole person approach, where it's like they're not only treating the disease state, but also taking into consideration socioeconomic and psychosocial factors for every patient, every veteran that we serve. And so at least this is just coming from the VA standpoint. I know other programs, as far as I'm aware, they usually they have like I think they have like a wider scope when it comes to types of patients that they see, because it's not just those who are like veterans. It's also people who are pretty young, like around my age, and also those who are adolescents too.
Yeah. And that can be one of the cons, to working with the VA or a pro, depending on what you're interested in, because when you're thinking about people that worked in the armed services, they're more adults. They're not any kids. So some people might want to work with, pediatrics or adolescents, like you said. So that might be something to kind of differentiate what you should apply for or programs you should be interested in for residency, because there are some that have that pediatric or adolescent, mental health component, and some that only focus on adults, like the VA.
I would definitely agree. Yeah, it's definitely a unique population. I really like to hear and read in on like the stories as to how things have like been for the patients that I see now, and just being able to provide them any help in any way, whether it may be something from like a pharmacotherapy standpoint versus having to consider or maybe like educate on self-cognitive behavioral therapies to make the change that they can make when they realize they find themselves in a certain situation that either scares them, frightens them, or worsens like their current mental health overall.
Yeah, certainly. And then what you mentioned that you kind of realized, or you thought that maybe this wouldn't last forever. What kind of made you think that the situation you were in wouldn't last forever, to kind of help push you to apply for residency programs? Because I'm certain there's other people listening too that might feel that way, but I want them to kind of resonate with you on that.
Yeah, and I think that's a good question to ask. I felt as though like the more that I was currently at my current like place of work, the more I felt as though I wanted to kind of break the ceiling, for better lack of words, where I wanted to be able to do a lot more clinical hands-on, and eventually have the goal of really just having like my own kind of clinic where I'm able to provide chronic disease state management, and not just like dispense medications on the dispensing side, as well as like verifying and whatnot. And so it was that, and then also the drive to be able to go into teaching. And that's where I actually had to reach out to some of my professors from my alma mater to provide me some guidance as to how to go about my potential career path. And when I had this conversation with them, they had mentioned residency, which they have brought back to the table. It was something that, like, I think within 1 or 2 years after school, I didn't really even think about it. Like, I didn't even want to like have like the thought of that like happening at the time, just because I was focusing on trying to support family and whatnot. But then by the time it hit like about the 2 to 3 year mark, that's where I was like, okay, time to reassess. Time to speak with my people that probably know about the field better than me, and see where I can go from here. I think it's really the academic component that I think really kind of drove me, as well as also I wanted to also pursue board certification in psychiatry too, and that was something that I needed to have some type of guidance for prior to making any like next choices, really.
Okay. Yeah. And I think that's a very smart choice, what you did there, and something that I would recommend anybody to do. Try to reach out to your previous academic advisors or individuals that have some long-term experience in the field that you're interested in. So that way they can really attest to what might be the best route for you. Because I think a lot of times with pharmacists, they don't think outside of the box. It's very regimented, the thought process. So it's like, if I don't do this now and I just start working right after school, I can't go back and do a residency, or I can't go back and do a fellowship, or I can't get some type of certification, or this career path is now done. I'm now boxed into this, where it's really, you can create the career you want from people that I've talked to. You just have to talk to the right open-minded individuals, and they'll show you like, hey, you can do this. You might have to do some extra work by doing a residency, or by doing a fellowship, or by getting certified, or doing all these different things. You might have to put in some extra work for a year or two, but then that career that you've always desired will start to open up. And so that's something that I want everybody that's listening, whether you're a pharmacy student, a current resident, or a pharmacist, like, I think it's very important for you to always think outside the box and don't think everything has to be very regimented. Like, it's okay to work for a couple of years and go back and apply for a residency, and you can definitely match with one, as Mary has. So it's like, sometimes don't be afraid to think outside of the box to get to the situation you want to get to.
Yeah, I absolutely agree. And just to kind of put numbers out there in perspective, I had just not too long ago, I looked into the ASHP match statistics. There is a section when you go into the summary of statistics for each year. Towards the bottom, you actually are able to see how many for this year, for example, you'd be able to see how many pre-2022 graduates were able to match this year. And by just doing the math, just based off the numbers, I think from what I remember, it was about 57% match rate for those who have been out of school for some time. And then this is pretty significant, just because I think, when you look into earlier years, looking into 2018 actually had about a 33% match rate for those who are pre-2018 graduates. And so between 33% back then and about 57% now, I think the trend is kind of in your favor, in my opinion. And plus, I know, with the board exams eventually getting more difficult throughout the years, I know that with those who are going into, those who are in their final year right now, I know, they're studying a lot in terms of, passing board exams, both the law exam. I know California has a very interesting one. Yeah.
Yep.
And then also the NAPLEX, which has been changing quite a lot over time.
Mm-hmm.
There has been some discussion as to seeing some of the numbers, the pass rates, kind of fluctuate, more so kind of trending downwards. And so, a lot of programs are starting to kind of look into potentially looking into those who may already be licensed prior. And so this is just stuff that I have heard in speculation, but at the same time, I think just based off the statistics I'm seeing, as well as some of the information regarding a lot of the board exams, hearing recent graduates having to go through the cycle and having to get their California Board of Pharmacy licenses, that's just something to kind of consider. I mean,
it puts the whole program back, because their plan, the whole pharmacy department has a plan. They have a plan, a certain amount of residents, students, pharmacists that should be there. So when they start losing residents due to the exams, they're now at a detriment, and now burnout happens, right? You're putting more stress on the current workforce that's in the pharmacy, because they can't go out and go get another resident. The resident pool's already done. So it makes sense for them to start looking at people who are, hey, I've already done this. And I think another thing too that you didn't touch upon, which I'll say here, is if you've already worked and got pharmacist money, you're willing to take a pay cut. You must really be interested and serious about what you're about to do. So I'm going to look at that as okay, you're serious about what you want to do. You're already licensed, so I don't have to worry about this component that you mentioned has starting to become more challenging for individuals, which have prevented people from being able to stay within the residency program, which causes a burnout on the overall pharmacy department, because now it's more stress on the current individuals we have. So I think it's a win-win for people who are still thinking about pursuing a residency. I don't know if it's the same for fellowship, but I don't see why you shouldn't go for it. So residency or fellowship, if you're thinking about that, postgraduate, learning experiences, I would say definitely pursue it. Even if you worked for a couple of years, 3, 4, 5, I don't think it really matters. What matters is, what is your interest? What do you want to do? And do you want to be happy doing what you're doing? And if that's what your focus is on, then by all means, just go for it.
Absolutely agree. I know for a lot of people who are kind of like me, where it comes to working for a little bit, thinking about the pay cut, it's a sacrifice you have to be willing to make.
Yeah.
And also, the next question is, will you be happy? Will you be okay with the change that's about to become something that, you're going from about maybe six figures down to like 5 now and
Mm-hmm.
having to take like about 50% of a pay cut, something like that. Like, are you willing to take that risk, given the interest that you have? So big question to really consider, especially someone, as someone who's coming from like a financial hardship in the past.
Yeah. Yep. Definitely have to weigh your pros and cons. And then I know you have to go soon, so I'm going to shoot some rapid fire questions at you.
Right.
So the VA, you
Mhm.
decided to apply to it and you matched. So just real quick, why did you want to match with the San Diego VA?
So with the San Diego VA, what is really nice about their program is, one, I think they have I saw that they had a pretty strong mental health departments that a lot of pharmacists are involved in.
Mm-hmm.
2, they are very dedicated to having you get involved in teaching and working with students, and also being able to have like a good work-life balance as well. And then 3, a lot of the preceptors and a lot of the residents, from when I talked to them, they had mentioned a lot about receptiveness in regards to being able to express any hardship or any like guidance as to how to go about a certain rotation or just certain parts of residency overall. And so I think with VA San Diego, the big thing that is super charming about the program is that they're very receptive and they're very dedicated to providing you opportunities to learn in different areas. And so that's something that I thought was very good about them, and I ranked them pretty high.
Yeah. So you would say they're very well structured and they're very well organized with how they're preparing their residents for this residency experience.
Yes, that is right.
Okay. Perfect. So they have a strong structure in place. I think they've been around for a while too. So that makes sense.
Yeah.
And then they have that super dense mental health component, and then also the teaching component, which I know you've been harping on. Like, that's something that's very important to you, and that's something that you want to pursue.
Yep.
So you have those experiences. Can you think of anything that kind of separates the San Diego VA from other residencies or maybe other VAs for anybody that's interested in the VAs right now?
Okay. Well, I hate to say I'm biased about Southern California, but I really like being down in San Diego. It's much prettier than where I'm at in Orange County, even though it's 2 hours away.
Yeah, it's a beautiful city. I've been there.
Yeah, for sure. And I think with the patient population, I mean, yes, you are working with veterans, but I think you're working with both, obviously a very good handful of like male veterans. You also have female veterans. You have patients who are part of a very old group, and also those who are very young as well. And so I think in terms of diversity, you have that. And I think a lot of the veteran patients that I've spoken to over the past past few months is that they're very willing to listen in on how to go about like the next steps in treatment. Sometimes I'll even hear about like stories as to what they were involved in during active duty. And that's something that I thought was pretty rewarding to hear, and just being able to get involved in like working with these patients, working with the veterans. I thought it was pretty rewarding overall, thus far.
Okay, perfect. And then do they have any unique electives, compared to other programs? I know I'm just going to name a few because I know I looked some up and I saw one that I've never even heard of, which was spinal cord injury. So I thought that was interesting. I think I also see here they have nephrology, which is pretty unique, I would say. Which electives did you decide to pick up?
So so me personally, I had chosen pain as an elective, pain management.
Okay.
It's mostly just management in regards to non-cancer pain.
Okay.
And I feel like, the best way to describe it, as my preceptor at the time had, shared with me, is like both ambulatory care and psychiatry on steroids, where if they had a baby, pain management would literally be the elective. It would be the clinic. That was fun. And I got to practice a lot more in both my AM care skills, as well as my mental health knowledge because a lot of SNRIs, they overlap in both like the psychiatric and pain management standpoint. So I was
with
able,
arthritis and different things like that. Yeah.
yep. And then I also have academia towards the end of the year. What's also something that I thought was pretty interesting, that I think most other programs may not really have is it's called academic detailing. I don't have this, but I know a couple other residents that will have this very soon. It involves having to create like handouts that like either handouts or informational guides for different audiences. So like thinking of like health pamphlets and any like resources, quick guides, pocket guides for providers, and then also providing like patient information in pretty creative and also informative modalities. A lot of times it's just some things that are easy to just kind of pass as you have clinics, have patients come into the clinics. You just provide them like these little mini booklets or little handouts for them to be able to kind of read more into. And so academic detailing is, I think, something pretty unique here at the VA that most other programs outside the VA probably won't have.
Yeah, I've never heard of that, but I think that's great because it's well, I guess I'm going to say it now. I was going to say I've had thoughts and ideas of having like some type of like infographic rotation. I would love to be able to create one where it's like one kind of like through the podcast where we can go over like learning and like disease state topics, but also how to create like infographics or patient related content, because Google is not the answer. And that's where they keep going. And now if it's not Google, it's TikTok, and TikTok may not be the best place to go either. So definitely want to provide like your own personal handouts or personal information to the patients that you're caring for. So that way they can just get it direct from the providers that are taking care of them. And so that way they know it's trustworthy, it's accurate, and they don't have to go to Google or talk to a friend and their friend says, "Oh, I heard you're supposed to do this," and it's completely wrong. So to help avoid all that, I think it's super cool. Academic detailing is a rotation option, and one where you really get to build, those soft skills. So written and communication and making sure your audience is able to interpret the content that you're putting on there and making it very concise too, because you don't want to make it too lengthy because they may not read through everything that you provide them.
Oh yeah, definitely. And also using your clinical skills too, because that's the information you're providing. That's the content.
Yep. And that might be the future. That might be the new way of counseling. If things keep going virtual, it's going to go from handouts, in my opinion, to like little videos you send on an iPad or something like that. So you want to make sure it's as concise as possible and has all the relevant details. So that way, your patients can definitely use it. So I love it. Sounds like an awesome rotation. And then, so definitely some unique rotations, academic detailing, spinal cord injury. You mentioned the pain management. So they have some unique opportunities there. Now, I'm sure you've been asked this, but with every residency component, everybody wants to know about the staffing.
Staffing? Oh, yes. I can talk about that.
Please tell us. Yes.
Yes. So when it comes to the staffing component here at VA San Diego, really depends on which rotation you're on. For the most part, you don't really staff on the weekends at all, unless if you choose to do like a moonlighting internally here, where you may be working in the outpatient pharmacy or working as an inpatient pharmacist. So that's really like based off of any of the residents as to whether or not they want to do that. I'm one of those who's not doing that. But other staffing requirements aside, I mean, we have the required medicine rotation, which is about 8 to 10 weeks. And that's about, I think, 2 or 3 weekends out of the rotation where you have to work on the weekend. And then, I think for other, like, it's mostly inpatient that has like staffing that's kind of built in. Again, it's really about probably no more than 2 to 3 weekends, depending on whether or not you're in those rotations. So, critical care being one as well. Cardiology, I'm not too sure, but from what I'm aware, I think it's really just doing, weekdays. AmCare, there is actually a bit of staffing involved, except it's all built into your, work week schedule. So it's usually about 3 half days. So 1.5 days of staffing in the outpatient pharmacy, and then the rest of the week is all your clinics.
Okay.
And yeah, so a lot of times the staffing is kind of built into the schedule. Again, inpatient is something, again, you will have to work like different hours for the most part, but at least you won't be working graveyard shifts. So that's something that I do want to reassure everybody. But that's where the work-life balance is.
Just within the work week. So it's not really
for the
like
most part
more on the weekends. Okay.
Yeah. And then what's cool is that, I know, like for me, for emergency department, which is the rotation that I'm in right now, yes, there is a staffing component. It's usually the last 2 Saturdays of the block. What's cool is that even though I have those days that I have to work, I actually get compensated a day back. They try to stick to having a 5 days a week type of work schedule for you, not exceeding any more than that. And so I think I got like Wednesday off that week that I'm talking about. I forgot which week it was, but I am working a Saturday sometime soon. But but from what I remember, I think Wednesday I have off. So they're trying to retain the 5-day work week, basically, is what I'm trying to say.
That sounds very ideal. If I could go back to residency, I would. I would apply to this program for sure. Sounds like an ideal scenario, and you have such a vast amount of opportunities to learn in with all those different type of clinics and electives. Like I mentioned before, some of them that I've never seen before, like spinal cord injury. I don't think I've seen a nephrology. I don't believe I've also heard of or seen academic detailing. When I was looking for residencies, I applied to 10 different ones, probably looked at 30 different programs, and I don't remember seeing some of those. So I think that's pretty cool and unique. And they have all of the basic ones as well. So, ambulatory care, internal med, some admin opportunities, cardiology, crit care. So seems like they're very diverse. They have a lot of opportunities. Sounds like a great program, trying to keep you to a 40-hour work week type of thing, 5 days you're really working on, so you're not staffing too much to overload or burn you out. So it sounds like an ideal situation. It sounds great. And so if for anybody who's listening, because I know you got to go, so for everybody who's listening and they're still kind of hesitant about either applying to the San Diego VA or applying to residency, what advice do you have for them to kind of push them to pursue the best career for them? So they're thinking like, oh, I want to do this, but maybe they have some doubts. Maybe they're thinking, oh, I don't know if they'll accept me. I've been out of school for a year or two. Maybe my clinical knowledge isn't the strongest as it was when I just left school and rotations. What kind of advice do you have for those individuals?
Okay, yeah. I think very good question. I have 2 in mind. One being that, depending on your career path, there's always going to be different ways to get to where you want to get to. And so biggest thing, and this is something I also share with students as well, is residency is not the end all be all. And if that's the thing that I feel like a lot of some of the schools, especially the more competitive ones, kind of like, I guess, like share. And that's something that I think is something that should really be not on your mind. Like when it comes to like residency, that is one pathway to get to where you want. However, I have heard, and I've had like past classmates get to where they are without residency. And so that's something that they had been like very happy about, and they're still making the pharmacist pay and whatnot. Just also, I guess this kind of ties in with my second piece of advice, is really trying to keep connected with your mentors. Make sure to keep good networks. I feel as though, I think during the past 3 years, I thought, over time, my network has expanded. I feel as though when it comes to talking with a lot of California, schools of pharmacy, that I at least know at least a couple people that I'd be able to kind of talk to at least. And just being able to see them through my past involvements and just being able to catch up with them and let them know hey, this is what's going on. They'd be happy to help. And so that's just something to really keep in mind, keeping connections with past mentors, preceptors, and then other people that you also meet as well throughout the way. Pharmacy is a small world. Yes. So that's something that I feel as though over the past 3 years I've utilized to definitely get the guidance that I need to get to the path that I would want to pursue.
Yeah, definitely. Thank you so much. That's great advice. That's something I probably need to do. I haven't reached out to my mentors in a while, but definitely great advice. Thank you so much for your time. I know you're extremely busy. I know you got to get to work. So I just want to say thank you again for being able to squeeze this in with us. We appreciate it, Mary. If there's anybody listening that would love to reach out to you and kind of get in contact with you, what's the best way for them to do that?
Yeah,
LinkedIn,
sure.
email?
Yeah,
What do you
so
prefer?
yeah, LinkedIn and email. So LinkedIn, you can just find me, Mary Ngo, PharmD, BCM, TMS, and then um, also my email. You can reach out to me at mary.no number two at va.gov.
Okay, perfect. So I'll include those in the show notes. So everybody that's listening that wants to reach out, feel free to. Just one last thing real quick. Just want to say, I believe the application deadline for the San Diego VA PGY1 program is January 1st at
Mm-hmm.
11:59 p.m. So keep that in mind. I'm gonna try to get this episode released soon. Today's day's November 30th, but keep that in mind if you're interested in applying. Kind of got to move quickly. Got to get those letter of recommendations in and everything into forecasts. Let me just look real quick to see their application requirements. I think I saw it here. So 3 letters of recommendations through forecasts. They want your CV, letter of intent, and verify transcripts, which should obviously be sent to forecast as well. And so basically just fill out the forecast and set a letter of intent. That's
Mm-hmm.
basically it. It doesn't seem like it's anything extra. I know some places had extra requirements, but this one's the basic 3 letter of recommendations, a CV, letter of intent, and make sure to get those transcripts in. So that way they can verify that, you're in good standing with the College of Pharmacy.
Yes, and yeah, and there's nothing really special else aside from just those 3 things, and also everything else is kind of listed in our brochure that you can check out on our PBM website. But yeah, I mean, really just being clear, transparent in regards to what your interests are. I think
Mm-hmm.
the more that you have a lot of like mentors and others like revise and look over and provide you feedback on, the stronger I think of a candidate you are going into the cycle.
Definitely. And one last thing that I forgot to mention, which actually prevented me from applying to a lot of VAs when I was in my 4th year of pharmacy school, is that with the VAs, you don't have to be licensed in that state. You just need a state license because it's federal law. So you'll be practicing on a federal law,
Yes.
but you just need one state's license. So I didn't apply to any VAs out of state because I thought I would have had to get that state license, but I was wrong. I could have just got the Florida license and still be able to work at the VA in Atlanta or the VA in San Diego or a VA in Texas, for example. So all you need is one state's law for you to be able to work in the VA. So if that's
Huge
something you're
perk.
interested in, yes, huge perk. So if that's something you're interested, so don't let that deter you. Sorry, because that with other non VA programs, you'll have to make sure to get that past the state board in order to be licensed in that state. But with the VA, you don't have to. You just need one state's license. So that's something that's a huge perk, huge pro. So if you thinking about going to San Diego for a little bit, you can go there for a year, maybe 2, if you want to do a PGY2 there, and then maybe you come back to Florida and work in Florida. If you have that state license already, because you decided to do the Florida route. So that's just an example. If you want more information, you can reach out to me or you can reach out to Mary. I'll include her email and LinkedIn in the show notes. Thank you so much, Mary. I know you got to go. So I want to make sure
No
you can
worries.
get to it. You got to take care of our veterans. So,
All
don't want
right.
to keep you too long. So thank you so much. I appreciate it.
Yeah, no problem. Thank you so much for inviting me on.